High blood pressure is often called the silent killer, and for good reason. It doesn't cause pain. It doesn't show obvious symptoms. And for many seniors, it quietly builds over time until a serious event like a stroke or heart attack brings it to light. But what makes it even more dangerous is how easy it is to overlook the habits that contribute to it. Every day, simple choices, what you eat, how you move, how you manage stress, influence your blood pressure more than you might realize. The truth is, many people over 50 are doing all the right things on the surface. They take their medication, they go to checkups, they try to stay active. But hidden within their routines are small, often invisible mistakes, habits that seem harmless but steadily push blood pressure higher or interfere with treatment. And unless someone points them out, they continue unchecked, quietly putting strain on the heart, the brain, and the entire circulatory system. That's why this video matters. We're not here to overwhelm you with medical jargon or shame you for doing things wrong. We're here to give you clarity, to shine a light on the most common blood pressure mistakes seniors make and offer simple, practical changes that can make a real difference. Whether you've been managing hypertension for years or you've just started paying attention to your numbers, this guide is designed to help you take back control of your health in a way that feels doable, encouraging, and smart. Because blood pressure management isn't just about numbers on a screen. It's about staying active, thinking clearly, sleeping well, and enjoying life with confidence. And that starts with knowing what to avoid and what to do instead. So let's dive into the first blood pressure mistake and start building a stronger, more stable foundation for your heart health, one smart habit at a time. Mistake number 1. Skipping medications or taking them incorrectly. Managing blood pressure often starts with a prescription. And while medications are one of the most effective tools we have for keeping those numbers under control, they only work if they're taken correctly and consistently. One of the most dangerous and unfortunately common mistakes seniors make is skipping doses, taking pills at the wrong times, or stopping medication altogether without medical advice. It's a habit that seems small in the moment, but can have serious consequences over time. There are many reasons this happens. Some people forget. Others feel fine and assume they don't need the medicine anymore. Some worry about side effects, or they dislike the idea of depending on a pill. Still, others cut pills in half or take them every other day to stretch a prescription or save money. And while all of these decisions may feel understandable, they can lead to blood pressure fluctuations that strain the heart and increase the risk of stroke, kidney damage, or heart failure. Blood pressure medication is carefully calibrated for your body. It's not just about reducing a number, it's about protecting your entire cardiovascular system. When doses are missed or taken irregularly, blood pressure can spike without warning. That rise might not feel like anything at first, but over time, it quietly damages arteries and places more pressure on vital organs. And because symptoms are rare, many people don't realize anything's wrong until a crisis occurs. What's especially important to understand is that blood pressure medications often don't produce a feeling of wellness the way other medications might. You don't necessarily feel better after taking them, and that can make it easy to underestimate their importance. But behind the scenes, they are doing critical work, easing the pressure on your heart, improving circulation, and reducing your risk of life-altering complications. The good news is, this mistake is completely preventable. The first step is to make medication a routine, not a question. Take it at the same time every day, using reminders like pill boxes, alarms, or daily checklists. If you ever miss a dose, don't double up without asking your doctor. Call and ask for guidance. And if you're experiencing side effects, bring them up right away. Often, there are alternative medications or adjusted dosages that can help you feel better without risking your heart health. Also, never stop taking your blood pressure medication just because your readings look normal. That's often a sign the medication is working, not a reason to stop. Always consult your doctor before making any changes, no matter how small.